Bilateral total knee replacement, know the indications. Numerous patients suffer from painful arthritis on both knees. Antitis TKR has been debated in many studies. Some studies raise a concern for increased rate of complications, while others disputed. The purpose of the study was to investigate the safety and outcome following bilateral TKR procedures using the PSI jigs and regular surgical procedure. Underlying the indications for surgery, we had 37 PSI, 74 knees, 5,360 knees. In Germany, Spark overall 90 patients, 180 knees. Why to perform bilateral knees replacement? Painful knees on both sides, double problem, difficult rehab if just one leg. Shorter period of recovery and return to work, single anesthesia, cost effective and standard of care. So many studies have reported the functional outcome of simultaneous bilateral knees versus unilateral TKR to be better, including range of motion, flexion, and function score, and reduced stiffness. So we had 90 patients, 180 knees, 89 were with OA, and 2 patients with RA. Most of the patients were in varus, 88, and 2 were in valgus. The mean age was 64. Most of the patients were were female patients, and 40 were male. The BMI mean value was 31. Most of the patients were ASA 1, 2, because we know that the higher ASA score, the perioperative morbidity and mortality is higher. So the criteria is BMI less than 40, age less than 80, ASA 1, 2, and family support is very important. Exclusion criteria should be symptomatic radicular pain, muscle cramps, heaviness of legs, and pain around the knees without any limitation of range of motion. Any pain perception such as fibromyalgia, neuropathy, and depression should be excluded. Most of the surgeries were conducted under spinal anesthesia. The rest were conducted under general and spinal epidural. Most of the patients were up and walking the same day. The mean stay was 4.3. We started at 8 and we moved to 2. Take-home message is single anesthesia and isolated anesthetic risk provides a reduced hospitalization time, shorter recovery time, shorter absence from work, better functional outcome, patient satisfaction is high, stiffness reduced in single rehabilitation, substantial cost saving, reduced infection rate, and the key success for the surgery is patient selection. Thank you. From Tel Aviv.